Good morning, Bud.
Good morning, Fernando.
So I want to have this fireplace chat, very informal here at Jackson Hole, because I don't know if the new generation really knows everybody. And here we have the chance of talking to icons and people that basically design and helped us to practice today, all the procedures, techniques, devices, and so on. So, Arthur Burnett, and who is Bud Burnett, that we all love. See you in the AUA doing a lot of things, and you are at the Johns Hopkins Medical Institution.
Indeed, indeed. Well, Fernando, I'm honored and humbled that you're doing such a thing here as to preserve for the archives, perhaps some video footage of some of us. It's remarkable how you preface things. I consider myself somebody who's fortunate to have an opportunity to have a career in urology. And I think I'm just maximizing my career to just do great things. I know I've been involved in urology now, as you know, a good 25 years or more, but yeah, I don't look at it quite that way. I'm just as young and eager as anybody. I've just happened to have been around a little while, I guess. But I have a passion for the field, and I think a lot of the innovations and discoveries have come about because of just seeing where we can do things better and just having some wherewithal in terms of talent and opportunity and the environment, perhaps, as you mentioned, Johns Hopkins, where discoveries have been made, just to be able to continue where some of my mentors and leaders ahead of me have shown the way.
But tell me a little bit about where were you born? Where is home,
So I'm from Washington, D.C. I was born and raised in our nation's capital.
Wow.
I know Johns Hopkins, which is in Baltimore, doesn't seem like it's too far away.
No, right there, right? Yeah.
But I guess you're kind of a good start wherever you are. You just continue on. Yeah, I went somewhere else for undergrad. Went to Princeton in New Jersey, and then came back to Hopkins for medical school, and then was able to stay there with training and then come on faculty. Really an amazing institution, and certainly have been given the opportunity to be at an institution to have done training and then continue with the career.
So, did you have any influence when you were a kid to think about going to the medical field, or this was a passion that just basically flowered when you were a teenager or college, or just tell me a little bit about it?
Yeah, I don't think it's really too spectacular. I think it's just one of these sort of things where I think I had ability in science in my early years. I did not have anybody in my family who'd ever been at the level of a medical professional in the way of a physician. Now, my mother had done some nursing, but had stopped her career when the family came along. So, so I didn't really have anybody who was inspirational through the family, but through contacts, I was able to meet individuals along the way through high school, college, who were physicians, and I could see the impact of the field. And fortunately, I had some talent in science and medicine, and that's pretty much how things started.
Yeah, and when did you decide to do urology? Was that because I think our field is so not known when you're a medical student, and only if you have a chance, randomly you get to know urology. So how did it happen?
Sure. Well, I think you're absolutely right. I think that's a common sort of scenario for many to think, we're exposed so much more to, even coming through medical school, to other disciplines, and urology is just not that prominent. Now at Hopkins, I think that may be a little different. So I think that was a factor having come through that medical institution, which is considered to be almost the center of urology in America.
You've been there since medical school?
That's right. So I went to medical school there, did residency training, and then continued on in faculty there. So my exposure was I think significant by way of Dr. Patrick Walsh, who's the chairman, Dr. Donald Coffey, another good mentor, research scientist. The history of urology sometimes begins at Hopkins with Hugh Hampton Young, considered the forefather of the field. He was the original chairman at Johns Hopkins. So there's some exposure that came about through that. Now, that's not, the entire story of my exposure. I mean, I did have some sense of the field through some other family contacts even before going to medical school. But you're right. I think there is the notion that urology is, what is it? Urine or prosthetics, of penile prosthesia. I heard about that.
Right.
But I think I got excited about the field, recognizing a couple of important factors. Again, I mentioned the influence of mentors, but I also realized that there is an opportunity in the field to have impact. And that impact comes in a couple ways. Prostate cancer, for one, is a significant health disease state for Americans, but also in the African American community, in which I have a lot of impact and have nurtured that over the time, not only as a prostate cancer surgeon, but also being involved in the community with regard to awareness and things of that sort. So I recognize that connection. I think was very, very important for me. But also just coming through the early training and exposure, the urology field is exciting. New technology, new discovery, opportunities to contribute and make advances in the field. So it is a mixture of all these things.
And we became great friends after I left Baltimore. It's been 20 years, but we became friends through the AUA, going to these international conferences that the AUA could actually put the pathway for us to propagate a little bit of our knowledge and interact with the international urologists. And I know you do great humanitarian work. Can you tell me a little bit about it?
Sure. Well, know that our friendship, as you know, goes way back to Hopkins when you were there as a fellow, and even though you were in the endourology track, and I was more on the side of reconstruction and some of the cancer
Always
side
a
of it.
gentleman. that remember.
So, but we've had our interactions, but even it built upon that in years. And as you know, as you have done with great international activity, so have I. I mentioned having an impact in the African American community in the United States. Also, I've recognized how you and I have had impact beyond the borders of the United States to elevate urology, elevate how we are impacting on providing the best urologic care to international communities. I've recognized that in the Caribbean, South America, and even around the world, where we have had the privilege of the best training, the best technology, the best opportunities to have resources to bring about the best care, and then to try to extend that worldwide has been a mission of yours and mine, and certainly we've done that sort of thing.
And you go even other places, I spend time, you really do a lot of stuff.
Well, I do. I mean, it's a labor of love, and much of it is on my own personal time, on my own vacation time, on my own resources to do this sort of thing. Well, I spent a lot of time in the Caribbean for one, where I've recognized that I can have impact there. And there's a couple major training centers in Jamaica and in Trinidad where some of the urology trainees need mentors need didactic training and even need just training in terms of how they carry out surgical operations. So I go down into that area probably about half a dozen times a year.
Wow.
For 3 or 4 or 5 days at a time, depending on how things work out, to do that sort of thing. And in fact, I have an adjunct appointment at the University of West Indies in Kingston, Jamaica. So I do that sort of thing. So I've really dedicated an effort there for our neighbors that are just to our south, which are still practicing urology with limited resources and perhaps not the best opportunities. Yeah. So we need to do something better, and so that's been one of my primary areas. But as you know, I travel all over. I travel to South America, Central America. I travel Asia, Africa. I do a lot of mission work in Africa as well.
Yes.
So I'm all over the world.
So, and you wrote so many scientific papers, not only prostate cancer, but men's health, including all the erectile dysfunction and down to the basic science. And probably you had a lot of influence from Don Coffey and his lab and the way that he always approached a problem with a very scientific mind.
Sure.
But you also have a book or several books. Tell me a little bit about the subject and how much energy you have to put on those books, because this is printed literature, and I don't know if it's sometimes it's just scientific data, or if you put some of your own views, and tell me a little bit how you design those projects and how much energy you really have to
I can tell you, again, I feel fortunate to have some talents and abilities, but also being in an environment where I have been trained and have had mentors, as you mentioned, Dr. Coffey, and other examples, role models of how we can have impact in the field. And so, yes, I've been a scholar, I've been an academician, as well as a practicing urologist. And while I do a range of clinical work in prostate cancer, other cancer diseases, in the genitalia, genital region, pelvic region, and as well as reconstruction, I've decided that I can also give a real focus in the area of sexual medicine and be one of the leaders in the field. And with that kind of background, training, and the role models that have given me some direction, I've been able to influence a number of things that range from the original science of erections, penile erections, the science of nitric oxide, and the science that led to Viagra. I've been able to build that through original scientific work in my research laboratory, basic science research laboratory that I've done over the years. I've done a lot of work in the area of priapism, which is a disorder that affects African Americans with sickle cell disease very commonly, where there's uncontrolled erections with a lot of devastating side effects that occur with that. So I have an impact in that. And then most recently, we've been innovating in partnership with our plastic surgery team, the advance of penile transplantation now. And I've had a major role with all that. So all of that requires good scientific mind, good environment, but then also scholarship. And yes, I've written books. I've written hundreds of articles. It's a matter of just a little discipline and focus, and you go about communicating in terms of oral lectures, but in a written form too. And yes, I've written books on prostate cancer and books on men's health and things of that sort. So yes, I've been able to bring that forward with these different sorts of media, if you will.
Yeah, I think I was fortunate to see you before performing the surgeries, being in clinic, and the way that you really follow the fiduciary obligation you have with the patients, and the way that you treat the staff. So nowadays we have patient safety, quality of care. We also have to think about burnouts and teaching. More than anything, you also have to get grants and research. I know that your institution has a lot of endowments and you can do those things, but still, day has only 24 hours. So for the young people to know Dr. Arthur Burnett, friends call you Bud. They think you're the most loyal friend. You were always there when you commit to be there. You are there. And I'll tell the story, finalize our interview with the story about Jackson Hole, how you came when you really, it was difficult for you. But,
Sure. But to answer
please,
your question,
yeah.
I think it's a combination of factors that has allowed me to be productive. I think that's what you're saying. And yes, I wear multiple hats, but we all do. I'm a clinical practitioner. That means I take care of patients and I do surgery. I do education and training with residents and fellows.
Right.
I am involved in science and research and innovation, and I have an active research laboratory. So how are all these things juggled in addition to other things, being an ambassador,
Right.
an international urologist, and all these other kind of things? Well, I think it's a matter of budgeting time well, understanding who you're partnering with different activities, supporting them, but also figuring out how you can work within teams to get things done.
Right.
And having a supportive wife who understands I'm very busy as well, and that works out well. Good partners and friends, both at Hopkins and beyond Hopkins, with whom I've been able to interact with. And then just I think a self-reflection, maybe a philosophy of life that I kind of enjoy what I do. As Confucius says, I guess if you enjoy your work, you never really work a day for the rest of your life. And so every day I wake up with enthusiasm, I think, and I really have since then I've been given opportunities and abilities, and just go for it and make the most of my days.
But the young generation, they come to you,
Yeah.
they say, Dr. Burnett, please give me an advice, one, before, one of your trainees, before I leave Baltimore.
Yeah.
What is your advice?
Well, I think my advice is decide what is your passion. Certainly know that not everybody can be everything, so work within yourself, self-reflect, and realize what your abilities are and where you think you can make contributions. Yes, I may be able to do a few different things, and not everybody should necessarily do all these things that I do, but find what excites you, pursue it, to do it with great passion, and that still is going to be extremely valuable to our field, certainly important to that person and their family and what they're doing. So my advice is just look within yourself, find what makes sense, and just do it well.
What kind of music you like?
Well, I always tell my wife I listen to whatever's going on. I take in all things. I'm glad to just be open to whatever I can learn. But I tend to have a little bit of a favor toward smooth jazz and that sort of thing. Yeah, a little peaceful, relaxing kind of music. I'm maybe a little partial to that.
Do you have music during the operations?
In my operating room, I accept music. I don't think it's a requirement for my doing any surgery. Many times I'll let it play because the nurses and others in the operating room are comfortable with that, but I always tell them, let's not play it loud. We be focused with what we're doing.
Yeah.
But if that kind of helps you kind of feel that makes you comfortable with what you're doing, then that's really that's absolutely fine by me. But I do not dictate any of that. I tell them to proceed with what gives them comfort.
Want to be low, so you can communicate.
Absolutely, because we have a task at hand, which is the best surgery for that patient, and to orchestrate all of that and to make sure the team's doing their very best. I want to make sure we're communicating and then we're being focused on that operation.
Yeah, because patient safety, all the white papers now that we have written with different committees, and they did a great job, and I was able to participate, and it's all about how the leader or leaders in the operating room, pre-op and post-op, will actually behave. And you are always a gentleman, and you always think about the patient first, and 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 your colleagues and staff, you know. So I
Well,
think it's important.
yeah, I think you hit on something that's very important. I think all of us should have a certain sense of self-awareness, and yeah, we're the leader of that team as we are as physicians in many different arenas. And I think we have to understand that we set the tone for proper professional behavior, how we interact, all these sorts of things, and know that everybody around us is watching how we behave, and that we set the tone and are the model for behavior, and we need to make sure we do that correctly.
Right. Okay, so I know a little bit of music. What kind of food you like? Because you travel so much. And
well, you know, I'm open-minded with that as well. You know, wherever I travel around the world, I always had the sense that I should immerse myself with that location of the world in terms of an activity, in terms of the food. And so wherever I travel, I was in the midst of all the purpose that we're there, whether it's mission work or teaching or whatever. There's going to be some free time, and we should find some time to find the local activities, find the food. I'm open-minded with whatever it is.
But when you come back, you're at the BWI or some airport going home. Do you have like oh my God, I want to have this, you know, like a comfort food?
That's right. I need that sort of thing.
Yeah. What do you like? What do you you know, crave for?
Yeah, you know,
a soup or a burger or a hot dog. Or
well, I guess I think I'm all American, which means that to some extent within the melting pot of our country, I everything from Chinese to Italian to all a burger and fries or what have you. I've never thought like I've got to have something that you know, that I've got to have that to make me comfortable. But,
I see.
But I'm
no, you have a really great family. I am really honored to be considered one of your friends, and I have this story about Jackson Hole. Dr. Burnett was always present here, never questioned, even when the weather was terrible or anything like that. But I remember clearly one day you show up with your mother-in-law and your wonderful, beautiful, intelligent wife, and you had just injured your leg, and you are, I don't know, what do you call it? This
little scooter and crutches, I guess.
Little scooter and crutches, and he comes here.
Coming to the resort already with an injury.
The travel is terrible. Just going through the airport, I imagine that, but you never told us that you had questions about coming here, and that demonstrated so much. And you know, I think Rob Hopkins, who started this meeting, he always, you know, he's always thankful for the people that come here, and this is the opportunity that I can also show my gratitude, which will go for forever, you know. So thank you so much, Bud, and we'll continue to travel together.
Life's a journey, and we have to enjoy every day and every activity. So, Fernando, thank you for inviting me to come and allowing me to partake in all of this.
Thank you. Thank you.
Absolutely.